how are you doing?
Good.
Good. My name's Sydney. I'm going to be doing your assessment today. You wash my hands real quick. And I'm also going to close this curtain to make sure that we've got some privacy and that door is shut. So, can you tell me your name?
Christopher Pelley.
Date of birth?
8/11/94.
Any allergies?
Coding.
Okay, good deal. So today during the assessment, I'm going to be doing several different things. Initially, I'm going to be looking at you, and then I'm also going to be palpating where I'm going to touch you. At that point, let me know if you have any tenderness or discomfort. And then I'm going to do percussion. It's going to be me tapping the back of my hand. I'm going to be listening for different sounds. And auscultation, where I'm going to listen with my stethoscope. Does that sound okay?
Yeah, it's fine.
Okay, good deal. So when patient came in, went ahead and we checked height, weight, and vital signs. All were within normal limits. His body size and positioning was appropriate for his height and weight. He had a steady gait, good balance. There was no involuntary movements noted. He was dressed appropriately for the weather. His hygiene was good. He was alert and oriented ×4. And we also went ahead and did the Snellen exam, which was 20/20 without corrected lenses. And when he came in, he had a smile on his face, he had a pleasant effect, and he seems very cooperative and ready to do this exam. Okay, so what I'm going to do is I'm going to check cranial nerves, and that's going to be just making sure that neurologically everything's intact. It's just a few little tests we're going to go through.
Okay.
So the first thing I'm going to have you do is close your eyes, and I have a cup here, and I'm going to have you plug one side of your nose and smell and tell me what you smell.
Vanilla.
Vanilla, okay, good deal. And I'm going to have you do the same with the other side. And what do you smell here?
Vinegar.
Vinegar, that is correct. So that's cranial nerve number 1, olfactory, and it is intact. We did do cranial nerve number 2 already with the Snellen exam, which as I said earlier was 20/20 without corrected lenses. So cranial nerve number 3, I'm going to check your pupil size. Those are at a 5, and look at me right in the nose. I'm going to do this light. Okay, pupils react appropriately, both consensual and direct. See, they constricted down to about 3 millimeter, which is good. So the other part of this next cranial nerve is going to be the cardinal fields of vision. So I want you to follow my pen light without moving your head. Great, now I'll push it in to just check for converging. Perfect. With that, the cranial nerves 3, 4, and 6 are intact. That is the oculomotor, trochlear, and abducens. Since I'm already here, I'm going to have you look at this wall for me and look back at my pen. Good deal. I'm just making sure that you are accommodating appropriately there. So the next is going to be the cranial nerve number 5. It's going to check your sensation to your face and scalp. So if you could close your eyes for me and tell me when you feel me touch.
Now.
Perfect. And also do some big chews for me. Great. So cranial nerve number 5, trigeminal, is intact. Now with cranial nerve 7, I'm going to have you do some funny faces. Just follow me. I want you to raise your eyebrows up, squint your eyes, smile big, frown, and puff your cheeks. Perfect. At the same time, open up your mouth. Let me check for adequate saliva, and that is good. So cranial nerve number 7, facial, is intact. Now for cranial nerve 8, that has to do with your ears. I'm going to plug one side of your ear and I'm going to whisper a 2-syllable word. I want you to just repeat that word for me. Okay? So I'm going to touch you here.
Softball. Soccer.
Perfect. Okay, cranial nerve number 8, auditory, is intact. Cranial nerve number 9, that is a glossopharyngeal. That's checked 2 ways. One would be with the gag reflex, which we are not going to test today, but we will check swallowing, which is the second part of that. Perfect. Any difficulty with that?
No.
Okay, so cranial nerve number 9, glossopharyngeal, is intact. Swallowing also checks for cranial nerve number 10, which is the vagus nerve, and that is intact. I'm going to have you raise your shoulders up for me. Perfect. So that is cranial nerve number 11, spinal accessory. And then if you could stick your tongue out for me, move it left, right, up and down. I saw no abnormal movements, no fasciculations. Cranial nerve number 12, hypoglossal, is intact. So next I'm going to move on to your head, okay? So looking at your head, it is normal cephalic. It is positioned appropriately. Patient is sitting upright. He's slightly hunched over, hands are in his lap, and the feet are hanging off the bed. He had no difficulty moving to the exam table for this. So looking at your hair now, it is fine and brown. It's evenly distributed. Okay, I'm checking now for any nits, inhabitants, scaling, lesions, discolorations. I'll be sure to check behind the ears and at the nape of the neck, and I see nothing there, so that's good. So I'm going to touch, and I want you to tell me if you feel any discomfort.
No.
Okay, no tenderness.
No.
Okay, so no tenderness, no thickening, no nodules, no masses noted. I'm going to palpate your sinuses also. So here, let me get under your eyes. Here you go. Tell me if you feel any tenderness.
No.
Okay, that's the frontal sinuses. Any tenderness there?
No.
No tenderness noted to the maxillary sinuses, so that's great. Now onto your ears. They are symmetrical. They're proportionate where they need to be. See, we've already checked your hearing, so I'm going to touch now. Any tenderness there?
No.
Okay, I don't feel any nodules. I'm going to make sure to push on your tragus. Any tenderness there?
No.
Okay. I'm going to look inside of the ear. I see no drainage in the external canal and none there, so that's great. So I'm going to keep this with me because I'm going to go ahead and do your nose now. So looking at your nose, it is also symmetrical. We've already checked the patency of it. I'm going to have you look up for me. Okay, there's no septal deviations noted. Patient doesn't have any drainage noted, no lesions, no discolorations, nothing like that. So now with your eyes, we've already checked everything with how your eyes move, but I do want to look at it again. So your pupils are round. They are still about a 5 millimeter here. Your iris is brown. See, pupils also flat, and there's no inflammation noted to the eyes. Your sclera is white. I'm going to have you look up for me. All right. So the conjunctiva is pink and moist. I can see that your eyelashes are distributed appropriately to the top and lower lids. So I'm going to push on you right in the corners of your eye. Any tenderness there?
No.
Okay, I'm checking for any discharge, and there was no discharge to the lacrimal ducts. So that's good. So I'm going to put on some gloves because I do need to do the mouth now. So looking at your lips, they are pink. They're slightly dry, which is fine. Let's see. You get these on. All right. I'm going to have you open up your mouth for me. I'm looking at the buccal mucosa, making sure that that is pink and moist. There's no lesions here. Making sure to check in the upper and bottom lip. Now, can you raise your tongue up for me? I'm going to look under the tongue. Good deal. And open up wide so I can see your teeth. There's no caries or malocclusions noted. I do see some scattered fillings, which is fine. Stick your tongue out for me. Say ah.
Ah.
Great. Okay, so tonsils are a 2+. The uvula rises to midline. The color of the pharynx, uvula, and tonsils are appropriate. There was no exudate noted. I'm going to have you look up. The color's appropriate to the soft and hard palates, and those are also intact. Now, this part's a little uncomfortable. I'm going to have to get this gauze, and I'm going to have to mash around on your tongue, okay? I'm seeing if there is any nodules or any lesions noted. So stick your tongue out for me. Perfect. I am sorry. I know this isn't comfortable. Under the tongue also. Any discomfort there?
No.
Perfect. Okay, so there was no lesions and no thickening and no nodules noted. All right, throw those to the side. So next I'm going to go ahead and look at your neck. We've already checked that the spinal accessory muscles were intact. Your neck is symmetrical. Have you had any issues with it at all?
No.
Okay, I'm going to touch. I want you to tell me if you feel any tenderness.
No.
None, okay. All right, I'm going to palpate for your carotid arteries while I'm here. And that side and then this side. And those are both a 2+. I'm going to take my stethoscope and listen for any bruise. So I'm going to have you take a breath and just hold it for me. Perfect. You can let that out and then do it again for me. Perfect, and there's no bruise noted there. Good deal. So I'm gonna check the range of motion of your neck. So I want you to lean your head to the side, then the other side, down, look up at the sky, and then make a full circle for me. Any discomfort with that?
No.
Okay, to keep up with that, we're gonna do the range of motion in your upper extremities. Now I would do this bilaterally. For this, I'm just going to do it on one side. So I see no muscle wasting noted, no lesions, no discolorations. Going to have you raise your arm up, all right, up above your head, touch the back of your head, put your hand on your hip, and then put it back where it was. Perfect. I didn't feel any crepitus there. Range of motion was good. I'd like you to go ahead and bend your arm and straighten it up a few times for me. One more. Good deal. Range of motion is good. And then no crepitus noted. If you could twist your wrist around. All right. No crepitus noted. Range of motion was within normal limits. I want you to squeeze both my fingers. Squeeze them tight. Great. So bilateral grip strength is equal. I'm checking your nails now. The color's appropriate. Capillary refills less than 2 seconds. There's no dystrophy noted. Hold your hands up for me and don't let me push them together. Good deal. Can you move your fingers all around? So range of motion and strength in the fingers is good. If you can hold your arms like this, push out, push in, push towards me, and then push towards you. Good deal. So strength is also good in the upper extremities. I'm going to have you stand up for me. And I'm going to go onto your back now. So with your spine, I'm looking for cervical concavity, thoracic convexity, and then lumbar concavity, which is there. I do see that there is some scattered angiomas and nevi, which is normal for the patient. There is no lesions, discolorations, no deformities. I'm going to have you bend over for me at the waist. I'm going to touch, and I want you to tell me, do you have any tenderness through here?
No.
Okay, no tenderness. I don't see any scoliotic deviations, so that's great. And you can sit back up. Now to check range of motion, I want you to lean back, and then to the left, and then to the right. Any difficulty with that?
No.
Okay, great. So you can go ahead and sit down. Now, with the heart, what I would do is I would be listening to it in the sitting, leaning forward, and supine position. For this exam, I'm just going to have the patient sitting up. I would also make sure to listen to all areas with both the bell and the diaphragm. The first thing I would do was palpate the PMI. That's located at the left intercostal space, the left midclavicular line at the 5th intercostal space. And it's best to palpate that in the left lateral position, but I'm just going to feel it with the patient sitting upright today. That's great. So that part is also the apex of the heart, and where I'm going to listen for the bicuspid valve or the mitral valve. So make sure that I want to listen to the apex with the bell for this, because I'm going to listen and I'm going to compare it to this radial pulse. Okay, and there was no apical radial deficit there, and both of those pulses were 2+. Let me go ahead and check it. This one on this side, and that is also a 2+. So I'm going to listen to the remainder of the heart sounds. Going back to my diaphragm. So on the right side of the sternum second intercostal space, I'm listening for the aortic valve. Directly over on the left side of the second intercostal space is going to be the pulmonary valve. Moving down still to the left of the sternum to the fifth intercostal space is going to be that tricuspid valve. And then once again to the mid-clavicular line to the left at the fifth intercostal space is where I'm going to hear that mitral valve. Great. So everything sounds good there. I am going to go ahead and move on to your lungs now. So I'm going to put my hands on your chest and I want you to take a deep breath. Good deal. You can let it out. I'm just making sure that your chest rises symmetrically, and it does. I do notice that you've got some hair that's appropriate for age and gender to your chest. So the first thing I'm going to do is percuss. That's where I'm going to go tap the back of my hands and listen for the sounds. So I'm going to do this on both sides, and then I'm going to auscultate with my stethoscope. Is that okay?
Yeah, that's right.
Great. So with this, I'm going to be listening for resonance. Any other sounds is going to be an abnormal finding. Can you sit up for me just a little bit? There we go. There we go. So I'm going to come around to the back now. I'm going to do the same thing. Hands on your back, and I just want you to take a deep breath and let it out. Good deal. So the chest moves symmetrically also. Back to tapping back here. Also, I'm listening for resonance. Great. So I'm going to start by listening back here, just since I'm already back here. So I would listen for a full breath sound, but for a time constraint, I'm just going to listen and show you where I would listen. So around the spine, I'm going to be listening for bronchiovesicular sounds, and then with the back, vesicular sounds of the remaining lung fields. That's great. So moving to the front, it's very similar, except in the neck area, I'm going to be hearing bronchial sounds around the sternum, bronchiovesicular, and then vesicular in the remaining. Great. Okay. So at this time, I would do a breast exam, but I'm just going to verbalize that. So with the breast exam, I would check for some symmetry first. Any dimpling, any changes in the skin, any asymmetry. I would have the patient put their hands on their hips and lean backwards, and also lift their arms above their head to make sure that the breasts both move symmetrically. Then with the patient laying back and their hand behind their head, I would do systematic motions, the same on both sides bilaterally. I would start on the outer edge and I would move in a circular motion towards the nipple. I would be feeling for any thickening, any lesion, or looking for any lesions, feeling for any thickening or nodules or masses and discomfort also. Then at the after that, I would squeeze the nipple and check for any discharge. I would also make sure to check the axillary lymph nodes. The 4 that I would check for would be the pectoral, the central, the lateral, and then the subscapular. And I would do that bilaterally. So I'm going to go ahead and have you lay down so I can move on to your abdomen now. Okay? So looking at your abdomen, I'm going to have you put your hands by your side. I do still see some scattered angiomas and nevi similar to what I had seen on your back. There's hair to the abdomen that's appropriate for gender and age. There's a scar to the right upper quadrant. It's non-colloidal. It's a flat white scar. The patient states that he's had that for a long time. I see no pulsations, and the abdomen is flat. To add with the chest, I don't know if I said this out loud, but the chest is a 2-to-1 ratio. So shining this light towards me, I'm just looking for any abnormalities there. Good. So with the abdomen, the first thing I'm going to do is I'm going to listen, okay? So I'm going to use my stethoscope and I'm going to listen to the right lower quadrant. I'm going to move up and around. Great, and vowel sounds are normal active in all areas there. I'm also going to percuss. Doing that, I'm going to start in the right upper quadrant, and I'm going to move every 2 inches. And I'm listening for tympany here. So it does sound a little bit different compared to the resonance that was in the lungs. Great, and now I'm going to palpate for any tenderness. So I'm going to start in this right lower. I'm just going to move around. You stop me if you notice any tenderness. I'm also feeling for any masses or nodules, any enlargement. And this is just some light palpation. Have your bowel movements been normal for you?
Yeah.
Okay. When was your last bowel movement?
Yesterday.
Okay. Any difficulty urinating?
No.
Perfect. No burning or discomfort?
No.
Great. So with you laying here, I'm also going to palpate the femoral arteries bilaterally. Now that's going to be just kind of in the side of your leg here. So I'm going to push down to feel that. And that is a 2+. Come to this side. And that is also a 2+. So that's great. If you want to go ahead and sit up for me. All right. So I'll move down to your legs. Okay, so you can stand back up, and I know I've got you up and down all over. Feeling for crepitus, I'm going to check the range of motion in this left leg. I would normally do it bilaterally, but we'll just do it on this one. So I'll have you raise your leg up, go out towards me, and then drop it down. Do that one more time for me. Okay, good deal. So there was no crepitus noted. Were you uncomfortable doing that at all?
No.
Okay, you can have a seat for me. Now, I'm going to have you push your legs out, push them in, lift your legs up, pull towards you, and then push down like gas pedals for me, and then pull your toes up. Good deal. So strength is good. There's no muscle wasting there either. So if you could straighten your leg out, push it back down, do that a couple times. Great. No crepitus there. Range of motion is good. I'm going to squat down, and I'm going to have you move your foot around. There we are, and there's no crepitus there. Can you wiggle your toes for me? Okay. Now, looking at your nails, they are clean, color is appropriate. Cap refill in all of them are less than 2 seconds, and there is no nail dystrophy noted. So that's great. While I'm down here, I am going to go ahead and palpate some of the pulses here. So I've got the popliteal, which I'm going to feel these one at a time. Find that easier. Go. And that is a 2+. Okay. The dorsal pedalis. That is a 2+. All right. Posterior tibial. And that is a 2+. So that's good. I do want to add that patient has no lesions or discolorations on the lower extremities. Well, no abnormal discolorations. There is a cafe au lait noted to the right medial knee, which is normal for patient. He's had that since birth. So I'm going to get the other pulses now. I've already checked your carotid, and I've already checked your apical pulse. So I want to check your brachial. Can you straighten your arms out for me? There we go. Make that right a little better. And that is a 2+. All right. And I've checked your radial, but I want to compare them bilaterally. And that's a 2+. And then the ulnar. And that is also a 2+. So that's great. I'm going to check your sensation now in each of the extremities. So it's going to be for like a soft touch, light touch, and a soft, dull, and sharp. Couldn't get that word out. So I'm going to close your eye. I'm going to have you close your eyes, and I'm going to touch you in different spots on your arms and legs, and I want you to tell me when you feel that, okay?
Now.
Great. So sensation with that is normal. Now close your eyes again. This is dull.
Now.
Perfect. And next we're moving on to sharp. Close your eyes once more.
Now.
Okay, great. So sensations are good there. I am going to check your reflexes. So the first reflex I'm going to check is going to be your tricep. I'm just going to have you hang your arm here, relax it for me. Perfect. So that is a 2+. No, these aren't ever really that comfortable. Relax your arm. Let me hit that one more time. There we go. And that is a 2+. And that's, so we have the triceps, biceps, and then down here is the brachial radialis. Just relax your arm for me. All right, and that was a 2+. Just a twitch of the thumb. Now, I'm going to move down to the patellar. There we go. And that was a 2+. Now, I'm going to lift your foot up to check the Achilles. Perfect, and that kick down is a good response, and that's a 2+. Now, if you could lift your foot up for me, I'm going to do a small upside down J on the bottom. Great. And that was a negative Babinski, so that's normal. And the name of that one is the plantar superficial reflex. So all of those reflexes are good. That's great. I want to move on to your balance. Okay. So if you could stand up for me, I'm going to go ahead and have you touch. Let me get this real quick. I'm going to go ahead and have you touch your nose and then touch my finger. Okay. Great. Now, can you touch all of your fingers like this? Perfect. Now, using your hands, I want you to go palms and then the back of the hands, back and forth. Great. Now, take one of your heels and slide them down the opposite shin. And do the same thing on the other side. Perfect. So your balance and the coordination is good. To check your cerebellar function, I want you to do a tandem walk or a heel to toe walk. You can go ahead and walk this way to give you some room. So just heel to toe. Perfect. And you can turn around and just do it back towards where you were. Fantastic. So you can have a seat now. So cerebellar function is good. So just to make sure, a quick review that I've got everything. We've went over your head, we went over everything with your face, your neck, your heart, your abdomen, your spine, your lower extremities, your balance, and your sensation. Do you have any questions about this assessment?
No.
Okay, everything has, can't even think of my word. Okay, everything's checked out. Everything looks good. I'm not concerned about anything. I'm going to leave you to get dressed, but thank you so much for letting me do this assessment on you today.
Thank you.
All right.